In Section 6, we'll discuss intervention strategies. Previously in the training, we discussed crisis and how it's directly related to the victim. In this section, we'll discuss crisis and how it relates to a violent event at the workplace. Crisis does not happen spontaneously. It's the final stage along a continuum of behavioral and emotional responses. Individual response to stressful events will differ from person to person. The key is to have appropriate and timely intervention. Crisis development. This is a graphical representation of the 4 stages that lead to crisis. Stage 1 is a normal state, possibly with anxiety. Stage 2 represents a rising level of anxiety. Stage 3 is severe stress and anxiety. Finally, Stage 4 represents crisis. Early and middle stages of crisis development. In the early phase of crisis development, words and demeanor have the ability to decrease tension. Be aware of the following verbal strategies that may be helpful. Allow the person to express concerns. Use a shared problem-solving approach. Avoid being defensive or contradictory. Apologize if appropriate. Follow through as indicated. Avoid blaming others. The following are nonverbal guidelines that also may be helpful. Be calm and act calm. Make eye contact, smile, keep your hands open. Listen. Respect personal space. Convey that you are in control. Use appropriate body language. Avoid laughing inappropriately. Late stage of crisis development. During the late stage of crisis development, there may be a loss of self-control or problem-solving ability. Verbal and nonverbal interventions may not be effective. The following are some guidelines for these later stages. Work with a coworker. Be prepared to use a panic device. Position yourself to exit easily. Other than coworkers, remove other people from the room. If necessary, follow appropriate procedures to initiate a response for violent behavior. Setting limits during late stages of crisis development. When properly applied, setting limits can control an escalating situation, diffuse it, and help with some decision-making. The keys to effective limit setting are: use a command to express the desired behavior and provide a logical and enforceable consequence for non-compliance. When the previous strategies do not work, a person in full-blown Stage 4 crisis will be out of control, cognitively, emotionally, and behaviorally. They will not respond to verbal interventions. They display great fear, anger, or threats. They may cry or hyperventilate. At this point, personal safety and the safety of others is paramount.